All right, so basic care and comfort, that's what we're doing tonight. Some motivation for the week. Believe you can, and you're halfway there. Just keep believing that you can do this. Trust in yourself. Trust your own instinct in answering the question. Go with your first mind. Many times, your first thought is the correct answer, but make sure you're reading through the questions carefully. NCLEX is all about reading comprehension. A lot of it is content. We do have to know some basic content, but many times we know what to do, but we're just not reading carefully and we're not pulling out those keywords. Right, and then some other motivation. One of my students, I tutor on YZANT as well. She took her exam last Monday. That's when I will be taking a little time off after March just to revamp the question bank and everything for the upcoming next gen. It's an adult client. He's scheduled for a 300 milliliter bolus. So he's getting bolus enteral feeding. Enteral is going other way, other route by in mouth. So this is a feeding tube, right? Goes into his stomach. So he's getting a feeding of 300 milliliter bolus. It's scheduled every 4 hours. While preparing to administer the scheduled feeding, the nurse aspirates 100 milliliters. Okay, so she's taking out some residual, and that's what you want to do anytime before you actually give feeding or give medications or anything. All right. Now, which action? So now we're looking at our query. Which action should the nurse take? All right, so actions, two things. Is there a problem? Then we need to fix the problem. They don't really present a specific problem, but sometimes the assessment may let us know that there is a problem. So we have to kind of understand, what does that mean if they have 100 milliliters of gastric residual? So you use your assessment to know if there is a problem or an issue. All right, if there is a problem, fix the problem, help the patient. Um, if it's not, then we do what we need to do, right? We continue with our nursing skill or whatever we're getting ready to do. In this case, she's preparing to give them the feeding. Now, if there's a safety issue, we want to keep the patient safe. So those are your two things you're usually looking at. If there's no problem and no safety issue, then you just keep it going, right? All right. Now, our first option, so we want to look through our options: clinical reason. Take your time to read through it. Our first option, notify the healthcare provider. Now, when we're notifying the healthcare provider, I don't try to eliminate it right away, because sometimes you do. Sometimes you have to reason through it. So, what you should be asking yourself are these three things. Is there a medical emergency? Is this out of my scope of practice to take care of this patient and deal with whatever we're dealing with? Is this a change in patient condition? Did they give me a trend? Did they tell me this is getting worse or something? Right. So, any of those three things, you would notify your doctor. All right. So, how do we feel about option A? Are we eliminating it, keeping it? Okay. We got some no's. Good. Eliminate. Awesome. All right. Got a good consensus to eliminate this one. So, it doesn't sound like either of these are happening. Good. All right, option B, administer the feeding as ordered. Should we get rid of, eliminate the feeding, or administer the feeding? Keep it? Okay, good. Awesome. So we'll keep that one. All right. So we're going to compare it with some others. All right, option C, hold the scheduled feeding. Okay, should we hold? Okay. All right, we got to eliminate this one as well. So it all boils down to, is this too much? They're getting 300 every 4 hours, right? And so you can kind of clinical reason through that. How much of that has already absorbed? How much could be left in the stomach in 4 hours? Is that too much? So, yeah, that's a good choice. We'll eliminate hold the feeding. Okay. Should we flush the tubing with cold water? Okay, good. Got a lot of eliminates. Very good. Awesome. Very good. So we are going with B for tonight. Good. Administer the feeding as ordered. So let's see, opposite answers. We did have some opposite answers. We either had give the feeding or hold the feeding. A lot of times those, when you see opposites like that, sometimes those, one of those are the answer, maybe the answer. But not always. So sometimes that's a good way to say, well, I got two things are opposite. Maybe it is one of these two. Generalize your nursing knowledge. That's what you want to do. In general, what's the best thing to do? All right, so that's in Saunders. Saunders does talk about have a good step of how to put in the NG2. So you've probably seen this one many times. And here they mention that when we're checking residual, that is standard every 4 hours. We're going to aspirate, reinstill it. So you always want to give back the residual because in that residual, there's electrolytes, there's fluid. Unless it appears abnormal. Sometimes I have pulled back and I see it and it looks like cloudy, how do you say it? Clouded milk or something. It looks like it's spoiled milk, and I would throw it out. Or if the volume is too large. So by nursing discretion, I've seen some people will give half of it back. Some people will give most of it, maybe a third of it, or 3/4 of it back and throw out some. But in general, by the book, you want to give it back unless it's abnormal looking or the volume is too large, greater than 250. Withhold feeding if the residual amount is more than 100 or according to agency or nutritional consult recommendations. So this could change. 100 may not be all that bad for someone who's getting 300 at one time every 4 hours. All right, and then they also give some good steps on NG2, what to do before you give medications. You do want to flush it, usually with sterile water. We usually don't use normal saline, but I guess that's an option. But a lot of times we'll do sterile water or tap water. Some places do still use tap water. And it's best to use warm water because cold water can cause cramping. All right, so takeaways from this question. Many standard orders are to check residual every 4 hours. Only hold the feeding if the residual is greater than or equal to a specific amount. And that amount could be as high as 400. And I do see orders like that in the hospital. Sometimes it'll be a lot larger than just 100. All right, GRV, that's our gastric residual volume. 100 is within an acceptable range. Measurements are more important than an isolated measurement. So this is like we talk about trends, when you're just seeing one measurement or one lab value and they don't give you a trend and you're just looking at an isolated measurement. I don't know if that's worsening. I don't know if that's getting better. So a lot of times that's okay in general. If a patient is suspected to have a certain condition or labs or things, then that's something to keep in mind. All right, healthcare providers should be notified. So if we didn't think he was tolerating the feeding, then we would have other signs and symptoms. So gastric distension, diarrhea, nausea, vomiting. Then we would be notifying the healthcare provider to say, hey, he's not tolerating these two feedings. I've turned it off. What else do you want me to do? And then we're going to flush with warm water.